Well, hello, and welcome to Pediatrics, Family-Centered Care of Children, Nursing 6500. I'm Dr. Kathleen Muglia, and I'm super excited to be teaching you this course this semester. This video will provide you ways to be successful in the course. I'll offer you top 10 tips for success. But first, I'd like to remind students that there's many ways to learn in a course. And in this course, you will learn 3 different ways. One is from me, your professor. I have 30 years of experience in pediatrics as a pediatric nurse with over 25 years experience as a pediatric nurse practitioner. So I love to provide lots of case studies, examples, and stories about what I've learned to make learning come alive in the classroom. The second way that you will learn is from all the resources that you have. I'm not the only one in the world who knows things about pediatrics. You have your textbook, you have videos, you have your ATI resources and book. So you have many different resources to utilize throughout this course, and you will be using them. Number 3, you will be learning from your peers. Most of you come from having lots of experience with many different childhood disorders, experiences, and so by sharing together, you will learn together. By learning from these 3 different ways, peers, professors, and resources, your learning will stick. So not only will you remember this content for your test to do well in this course, which you will also remember this next semester and the next semester and after you graduate and for NCLEX and forever. So this content will stick. So here's the top 10 ways to be successful in this course. Number 10, read your textbook. I provide active reading guides throughout every module. So I encourage you to print up the reading guide before you read that module. Open up your textbook, and it can be a borrowed book, it can be a rented book, it can be a used book, or it can be a new book. You do not need the Course Point Plus resources, you just need the content in the book. But read. So it doesn't mean you have to read word for word, sit there for 3 hours and read, but you do need to read. So look at those reading guides, go to the content areas that I identified and look at those specific topics and identify the concepts that you need to learn. It's really important to be able to learn the content by investigating those different concepts. Also, your ATI book has readings, but they're very short. So each chapter in ATI is a few pages. So think of that as the cliff notes for pediatrics. Number 9, ATI. ATI has amazing resources that you will learn with. So appreciate them, utilize them, treat them as learning opportunities and activities and not just ways to earn points in the course. Number 8. Study aloud. The way that you know content enough is if you are able to teach it. So teach whomever you have in your life to teach, whether that is a roommate, a family member, a friend, a neighbor, a parent, a child, or a peer, a pet, a dog, a stuffed animal, whatever that is. Make sure that you are teaching that person or animal, teach them aloud. So I encourage you to think about and study and read pediatrics every day. And at some point throughout the day, teach that person about whatever it is that module is learning. For instance, if you're learning about asthma, as you're walking your dog, say, Lionel, today I'm going to teach you about asthma. You have asthma. It is a chronic inflammatory disease that causes ... Okay, so then you know it well enough if you're able to teach it. Number 7, be engaged. This is a predominantly asynchronous course. However, we do have lots of ways for you to be engaged with the material. So I really encourage you to be engaged. We have weekly synchronous sessions with me or the other professors for the course, and we will be alternating. So everyone is welcome to join those synchronous meetings once a week for an hour or so. And we will review case studies. We will go over practice questions. We will go over the key penned up points for that module so you can be sure you are learning what is the most important content for this module. If live synchronous meetings are not your favorite thing to do, or you have to work during that time, or you have other responsibilities, you can participate in an asynchronous discussion board, which the initial posts then would be due on Wednesday night, and the replies to at least 2 peers would be due on Saturday night. So you can choose which one is better fit for your learning. But I do encourage you to participate in the synchronous sessions at least sometimes. It's a very inviting, welcoming environment where I do not make students feel dumb for asking questions. I encourage questions. I want you to get it wrong in the discussion so you get it right for the test and in life. Number 6. Think of this as family-centered care. Who is your patient? The family. It's not just the 2-year-old. It's the mom, it's the dad, it's the caregivers, it's the 2 moms, the 2 dads, whomever it is. They are the ones who are going to be participating in the care with this child. A 2-year-old doesn't walk in off the street and say, I'm having some difficulty with my respiratory tract. The family's going to be the one to bring them in. So we have to care for them as a family unit, get them involved, see what their goals are. And that is the way that we're going to help kids become healthier. Number 5, the quizzes. The ATI quizzes, you will complete 10 over the course of the semester. I encourage you to complete these quizzes individually on your own. Don't look up questions as you're going through the quiz, but do the best that you can. So take the quiz after you've done the readings, after you've done some of the other activities, and you feel pretty confident about doing the quiz. Then once you do the quiz, whatever grade you got is what you got, but then you'll complete at least 3 concepts in an active learning guide in ATI, and you'll submit that. And that's where your learning is going to take place, not by just doing question after question after question, like you may have done in EAQ or Prep U, but it's actually looking at the question, seeing why the correct question answer is correct or why you got it incorrect. So you'll have the answers to that after. You can do the quiz again and to get the right answers, but you don't have to achieve a certain score on the quiz. Number 4. Pick a topic that you'd really like to investigate more deeply. Is there a topic that you're really passionate about? Is it about patients with cystic fibrosis? Is it Duchenne's muscular dystrophy? Is it psoriasis? Maybe it's a condition that a friend or a family member or even yourself had as a child, and you'd like to have that be your topic of interest. That will be your topic for 2 activities or assignments during this course. That is, 1 is the research discussion post. So you'll really be delving into the research on what a caregiver's perspective is on that disorder. And then you will also be choosing that same topic for your patient teaching video or your parent teaching video. And so make it simple for yourself. You'll only be picking 1 topic that you'll really be the expert of in this course. And then you can double dip and use the research for the research discussion post and for the patient teaching video. Number 3, learn with your peers. For instance, your case studies in ATI that are due. Do those in groups. Get together with some of your friends and complete those case studies in a group setting. Now, you each need to individually enter into ATI the answers to the case studies. You need to complete them on your own laptop, in your own ATI sign-on. However, you can, and I encourage you to get together with friends, with peers, and go through those case studies together. Pretend that they are clinical, because that's the way students learn, by doing. And so if you engage with your peers, you engage with those case studies, it'll make it more fun. Number 2, pharmacology. You had a whole pharmacology course in your first semester. So don't forget everything that you learned. Really build upon that and apply what you learned in pharmacology in your first semester. So for instance, again, with asthma, we're going to be looking at the anti-inflammatory medications, steroid medications. We're going to look at different inhalers, bronchodilators, metered-dose inhalers, all those different medications and how they apply to the pediatric disorders. So you can complete the active learning guides for your ATI quizzes, you can complete medication. So maybe that is one of your 3 concepts that you would be remediating for a quiz is on medications. So every semester you should be building upon and applying what you learned in pharmacology. So don't think of it as one semester you learned pharmacology and now you can forget about that. You'll be in clinical, so you'll really be applying that. And lastly, number 1 in this course, I'd want you to have fun. Pediatrics and caring for families is a fun topic. Learning should be fun. So as much as you possibly can, I do want you to enjoy learning, enjoy the activities, and hopefully you'll have a great semester. And then lastly, real quickly, how to get a hold of me. Email is the best. So kathleen.muglia@marquette.edu. I do return all emails within 24 hours on Monday through Friday. If you do not receive an email response from me within 24 hours, Monday through Friday, please email me again. It's not that I didn't want to respond to you. I probably looked at it, thought about it, and forgot about it. Or I didn't see it. So please email me again. You can also call me in my office phone as well. Or over the weekend, please allow 48 hours for me to return emails. That's it. Have a great semester. Take care. Bye-bye.